welcome to today's Medicare training in this series. This is Medicare and Veterans. This is Trainer David coming at you from a hidden location somewhere in the Pacific Northwest. Actually, I'm just in my basement home office for the quarantine. Let's see, and today's topic is going to be the veterans of Medicare. And I always like to do to start things off with is how many of you out there are veterans? If so, if you're a vet, chat me with your name and service. I'll start. I'm a veteran. I was in the Navy, joining right out of high school. Now that's me there in the center, talking on the microphone. And my last ship, USS Blueback, for those in the Portland area, that is the submarine down there at OMSI. Went in as a seaman recruit and left as a lieutenant commander. All of the time was spent in the submarine service or a submarine-related shore position. I did a lot of truly crazy things, and you'll find that all veterans did. Just ask them, and they'll tell you their stories. When they're in that right, well, you should just about anybody. I wouldn't say necessarily the retirees, but you can literally ask anybody. You know, if they're a veteran, it's a great icebreaker, and they'll help you with your needs analysis. Here's our agenda here for today. We'll talk a little bit about the veterans programs, a few of the other programs out there like TriCare and CHAMPVA that deal with veterans, and then we'll have a little closing there. I'll answer some questions. We start off with, who are these people? When we speak of the uniformed services, there's actually 8 of them. Now, most people don't know them all. 6 of them are known as the Armed Forces, and 2, they're called the Commissioned Corps. Now, they're all going to be using the VA. So these are the ones that most people know right off the bat. That's the Army, the Navy, the Air Force, the Marine Corps, and the Coast Guard. The first 4 there are under the Department of Defense, and the Coast Guard is under the Department of Homeland Security. One that's not shown, because it's brand new, and we won't see any of them at least for a while when it comes to Medicare, and that's the U.S. Space Force. They just started last year, so I don't think we've had anybody retire out of that yet. The other 2 are the Public Health Service, Public Health Service officers, and the National Oceanographic and Atmospheric Administration. With all this news about COVID-19, we see the Surgeon General, Jerome Adams, on television all the time. And if you notice that the uniform that he's wearing, he's got it depends on which one he's wearing, but there's 3 stars on the lapel. It's actually a naval uniform, and his rank would be Vice Admiral. He's the head of the Public Health Service. So people always ask, why a naval uniform?
Please charge.
People are always asking, why a naval uniform? Well, I have to kind of go back and look a little bit at the history of that. And the founding of the Public Health Service came from what was known as the Marine Fund, or the Marine Hospital Service. And when I say Marine, don't think of the Marine Corps, but think of the Merchant Marine. All the civilian sailors out there bringing the goods and services, bringing goods into the U.S. Now, the Public Health Service spent the first 141 years under the Department of Treasury before winding up under Health and Human Services, and that move was made in 1953. So the other corps is known as NOAA, or the National National Oceanographic and Atmospheric Administration. Those guys, again, came out of what was originally known as the U.S. Survey of the Coast. That was back in 1807, went through several name changes before becoming the U.S. Coast and Geodetic Survey. And it stayed there from about 1878 to 1965. In 1965, it got, for whatever reason, renamed to the Environmental Science Services Administration. That lasted for about 5 years, and in 1970, NOAA appeared. So as far as people are retiring, you can still see all three of those names when you talk to people. I've actually, in my dealings with Medicare, only ran into one public health service officer. Never ran into any of the NOAA, Geodetic Survey, or Environmental Science Administration. But I just point that out. Now, all 8 of these, the 6 armed services and the 2 corps are serviced by the VA. So we'll talk more specifically here about the military veterans. Okay, 18.2, about 7.6% of the population. Now, according to the Department of Veteran Affairs statistics, there's still about 389,000 or so of the 16 million Americans who served in uniform in World War II that were still around in 2019. Most of the World War II veterans are leaving at a rate of about 350 a day. So America's greatest generation is kind of slowly, passing away. Now, of those starting Medicare, most will be Vietnam era veterans. Okay? The largest group in the VA are going to be the Gulf War veterans. They kind of took over in 2016. We still have about 6.8 million Vietnam era veterans, but 7.1 Gulf War era. Okay, and remember that literally spanned from August 1990 to present. So those guys are going to be the biggest group for quite a while. Although most of those, you figure that was started 35 years ago, are not the ones going into Medicare yet, unless, due to their disability and that sort of thing, I guess they could transitioned over to Medicare early. Most of the ones at the VA, of that 18.2 million, we got about 9 million actually, in the VA hospital system, of which 25% have a service-connected disability. Now I want to keep that term in mind, service-connected disability, because that is going to be what is going to be dependent upon what you get. You'll see here in a moment, but service-connected disability is an important factor. And of all of these, 9 million, about 2 million of them are female. So when we look at the VA programs, there's quite a few, disability, pensions, education and training. We always think of the GI Bill, right? Burial, home loans, think of the VA loan. Okay? Some insurance and some rehab stuff, but today's topic is really going to be healthcare. So understanding just what healthcare is provided by the VA, where the holes are, is kind of the purpose of this webinar. In order to really help this group, we need to know kind of what they're getting and what does it cost for the individual. This is kind of the mission statement coming out of the VA. Each veterans medical package is unique. Anyway, kind of going through that. Looks like any other health system to me, whether it would be Kaiser, just kind of name your little health group where you live, and I would say that they're going to give you that same kind of mission statement, something very close to that as to what they're trying to do for their members. The big question that comes up all the time is this one, is the VA healthcare actually for free? The real answer is it depends. And when you really get down to it, it's going to depend on the priority group. We'll go into that a little bit more here, and their financial situation, depending on what they make. So we're going to start off with taking a look at what this priority group stuff means. Now, when somebody originally applies to the VA, what happens is they get assigned a priority group. And what that really deals with is two things. How quickly they're going to go through the getting the individuals signed up for their healthcare benefits, and then it will go on to determine exactly what they will pay for those benefits. Now, I don't want to try to rationalize what puts one person in one group over another. It's just that it's going to help to know what group they're in, because that's going to tell you what their costs are. So priority group 1, and that's their highest priority. In here as those who have been rated at 50% or more of disability. So that's usually something that's happened to them. It doesn't necessarily have to be in combat or anything like that. It just says that while they were in the service, so it's connected to their service. And the other ones that are in priority group 1, there's Medal of Honor winners. Now, there's really, as far as that goes, there's only about 103 living Medal of Honor winners. So that's just a really small portion of all those receiving anything from the VA. Priority group 2, now we're looking again at that service-connected disability, and it's 30 to 40%. We want a priority group 3. First of all, those have a service-connected disability of 10 to 20%, but we've added in a couple of more things. If you're a former prisoner of war or a Purple Heart recipient. Now remember, Purple Heart is wounded or injured, wounded, injured, or killed. We're not going to really be dealing with those that were killed, but in action against the enemy. Okay, so that's an important thing. So it was in combat that it happened. Yeah. And you could be discharged for a disability that was caused or got worse because of your active duty service. You still had to be, at 10 to 20% to be in group 3. Now we see here in group 4, these people can be disabled, but it's not service connected. In other words, how about, I had time in the service, and then after I got out of the service, I was in an automobile accident and it left them quadriplegic. Okay, so that they do have a catastrophic disability. However, it was not connected to their time in service. Now, in group 5, there's no disability, but they're receiving some kind of a pension benefit from the VA, or they're on Medicaid. So we're looking at somebody in a low income category. Now group 6 is kind of a real catch-all group, okay? So you could be disabled 0%, that's that first bullet there. Only the government would say that you're disabled and your disability is 0. I personally fall into that category. I did have some hearing damage and some other little things like that don't give me a disability that qualifies me as 10% disabled or anything, but I came out with that service-connected disability with my hearing, but I'm rated at 0% disabled. Okay, and the rest of these are dealing with things that happened over the last 75 years or so. You could have been involved in some of that atmospheric testing, for radiation, either during World War II or some of the testing that took place afterwards. Could have served in Vietnam where you were exposed to like Agent Orange. Could have been in the Persian Gulf War, where you got exposed to other chemicals that were out there in the desert. Could have been in Camp Lejeune, North Carolina. Between those dates, it seems that there was some sort of environmental problem going on there, probably dealing with some kind of, dumping that had been probably going on, but wasn't considered a problem at the time, but looking back it was. But here's the big group that falls into here. It's those who are discharged from the services and within the last 5 years were in combat. Okay? So they're returning combat. 7 and 8 have no disability at all, where group 7 is low income, and group 8 is fine income-wise, has no disability, but qualifies for VA due to their service. Just a quick summary here, so it'll kind of make sense later on. Groups 1 to 4 have some level of disability, where it's 1 through 3 is service-connected. 5 and 7 are your low-income groups. 6, combat zone, or that was at 0 disability, but you do have some kind of disability. And group 8, literally everyone else. We were going to attach some numbers to that. We kind of go like this: 1 through 3, and that's that service-connected disability. It's about 2.25 million people. In groups 4, 5, and 6, there's 2.3 million in that group. And then in 7 and 8, literally 4.5 million in that group. And that's going to give you all those people there using the VA for their health care. Okay? So as you can see, group 7 and 8 is more than half. Okay? So what do people pay in there? It always comes up, what kind of copays and stuff there are. A lot of people think it's all free. Well, it will be for some people, but this is where that priority code comes in. It's going to determine what your copays are going to be. One of the things that a lot of people try to make is those priority codes are going to, a 1 will get service before it's 6. No, it doesn't have anything to do with that. It's not like a preferential code. That part dealt with how soon they processed your VA paperwork. The next thing it does is goes to how much you make. So there's no head of the line privilege for a 1, but they will, you'll, as we'll see here, pay a whole lot less. So we'll start off with urgent care copays. So if you do more than 3, everybody pays $30. But if you're in groups 1 through 5, 0 copay for the first 3 visits to a urgent care. If you're in group 6, they're going to go back to, is that trip to urgent care related to one of those special conditions? Right? We talked about those, whether it was like the ionizing radiation, Camp Lejeune, that project Shipboard Hazard and Defense, SHAD project 112, that dealt with asbestos. Okay? That was on ships. Okay. Yeah, and then 7 and 8, like I said, $30, whether it's the first 3 or any later on. So theirs is always going to be $30 to go to urgent care. Next one we'll look at is inpatient. Okay? So if your disability rating is 10% or higher, 0 copay for inpatient care. Then 7 and 8 has a different table. 4, 5, and 6 are all rated differently. So if you're in 7 and 8, you can see that you're going to start off at the daily rate for the first 90 days, or one-time copay, plus a daily rate. And looks a whole lot like Medicare there for group 8, right? It's the same cost. but this is your cost to the VA. So, I mean, you can look almost right away and say that if somebody is in 7 and 8 and it comes to inpatient, they should be looking at those Advantage plans already, right? Because it's going to probably get you a whole lot smaller copay for seeing the doctor or for hospitalization. Outpatients, okay? Again, if you've got 10% or higher, you won't pay anything for outpatient care. And if it's not service connected, so basically we're back to priority code 1 through 3, which is that's 10% or higher, no required copay. Everyone else is going to use this table. Okay? And so primary care services, $15. Specialty doctor, you're looking at a $50 copay. And any specialty test, that's going to be another $50. Not bad, although I've seen a lot of Advantage plans do a lot better than that. Okay, so just keep that in mind, because it's really, as we're going to see later on, get down to that needs assessment. But you can see those are the costs there. But look at that note. If you're doing any kind of x-rays, lab tests, preventative tests, health screenings, and all of that, you don't pay anything for any of that, regardless of your priority code. So I'd, you can see how it might fit in with an Advantage plan to get some of those costs in. Okay. Then let's look a bit here at medication. So let me tell you right off the bat, only priority group 1 has 0 copay. So that's the greater than 50% disabled or Medal of Honor winners. Okay. Everybody else is going to follow this table. Okay. Now, I'll tell you, I've seen better copays and PDPs and MAPDs, especially for those generics, those tier 1 and tier 2. I've seen many a plan that'll do those 90-day supply mail order at 0 cost. But look at that tier 3. I mean, that's going to be a tough one to beat. Okay. Take something like insulin, where it's always in a name brand. Okay. Those are pretty low cost there. Okay. But I'd also call out on here, we don't see a tier 4 and 5. That wasn't just omitted. There's not a tier 4 and 5. Okay. So one of the things that the VA is known for is generic drugs. Unless you fall into something where there is no generic, tier 3, and their formulary is very limited, especially when it comes to name brand drugs. The thing though that's going to really be tough to beat though when it comes to prescriptions, max out of pocket is $700, and then they're all at 0 cost. So that's going to be a tough one for you there to beat that. Now, you go and see a civilian doctor and you want to go fill your prescription at the VA. Well, they've got a few hoops for you to jump through. Okay, I mean, they'll fill that, but look at that. You got to be enrolled in the VA healthcare. You have to have an assigned primary care provider. You have to actually take your records from your civilian doctor visit to the VA, and that VA doctor has to agree. Okay, so you're going to have to take it to your primary care doctor at the VA. So one of the things I would tell you though is that if you take that prescription assigned to you by a specialist, you're not going to get a primary care doctor that's going to not agree with it. Okay, you still run the chance that he prescribed a name brand and it's not available in the VA health system or formulary. They do have quite a list of things here that they don't do a copay with. I mean, it's for everybody. There's no copay. Most of it, as you'd see, is going to be for your service-connected disability. However, look there on the lower right-hand side. There's some lab tests and EKGs, that sort of stuff. Those are all going to be at 0 cost. So for anybody using the VA at all. So there's a lot of good services that they can get there um, with the VA at no cost. Yeah, this is one that I use a lot, especially when trying to sell to a VA member who try to get them over into a Medicare Advantage plan. Is this one here? Your non-service connected emergency care. You know, something's happened, you have wound up in the local emergency room. Now, I'm going to tell you right up front here that the bottom line is that in the end, the VA will pay it. However, they don't pay the emergency room. They pay the individual back for having paid their bill at the emergency room. So it's like a lot of things. You file a claim for the money you expended to get it back. And there's a few things that will be on there, possibly, that they will not pay for. Okay. So if it's something that the VA didn't cover, then they wouldn't be paying for it. But the answer is, yeah, they'll pay after you have paid, and then they'll pay you back. Okay. So some programs that the VA also has in here. If you can remember back, it seems like yesterday, but it was really like 20 to 30 years ago. There was some real problems with the VA. People were literally trying to get in and dying before they could even get approved to use the VA. Okay. So the VA came out with the VA Choice Program, and that let them see a doctor in the community rather than, having to wait for somebody to treat them at the VA or even to get into the VA and get an appointment. The conditions for using the choice program, excuse me, was that you had to travel more than 40 miles or wait greater than 30 days. That would allow you to go and see a doctor there in your local community. Another program that came out was called the VA Mission Act. In this case, it seemed to me like the VA was really trying to set up like an HMO where they would get recruit doctors and facilities, in the local area where the veteran lived, and try to get those so that the veterans could go there. Okay. And so what they did was set up the conditions to be able to participate. Was that just 30 minutes drive time or 20 days wait time for a PCP appointment or mental health appointment. And if the VA couldn't meet that, then they would let you go see it, an out in the civilian sector doctor, or for a specialist, it would be a 60-minute drive time or 28 days wait. And then for those that were eligible in the program, access to urgent care facilities that were in the VA's contract. So they're going to recommend that you enroll in A and B, and just like you would if you were anywhere else outside the VA. In other words, you have a group insurance from a current employer, you don't get A and B then either. But just like that, the same kind of consideration. So if you got it at work, great. If not, the VA recommends that you get A and B. And the thing that I like to point out here is that all these programs are separate. There's no coordination of benefits. Each one is a separate thing. Having one has no effect on the other. So if you're using the VA, if you're Native American and you're using tribal health, your choice to use Medicare or not Medicare or no Medicare has no effect on what you get at the VA. Okay, so if you have a plan, and you do have Medicare, then great. I'll go back to that emergency room problem. Remember that you had to pay that bill and then go back and file a claim with the VA to get your money back. If you were using Medicare, then Medicare would pay that bill, and you'd be only on the hook for 20% that you had to pay. And then you'd be filing through the VA to get your 20% back. And then if you were using a Medicare Advantage plan, many of those have, like what, $100 to go to the emergency room. That would be your share, and you'd be filing to the VA just to get your $100 back. So as you can see, there's going to be a lot of advantages that you're going to want to point out to members that are using the VA who don't think they need anything else, showing them what they do and that we can get that at a pretty good cost and that it will help them out quite a bit. Now, the VA does authorize, a non-VA hospital, but it doesn't pay for the services you get during your hospital stay. The Medicare may pay the Medicare covered services that the VA doesn't pay. So if you choose not to enroll in Medicare and just keep your VA coverage, you would not have health insurance for the facilities outside the VA health system. Some choose to just enroll in Medicare Part A because it's premium free, but they turn down Part B because of the additional monthly premium. Well, if you want to enroll in Medicare in the future, you may have to face penalties and would likely have to wait for general enrollment to be able to, that's that 1 January to 30 March to even be able to enroll in Medicare, and then you would have to pay the penalty for late enrollment. So we highly encourage that even though that you're getting service at the VA, that you do get Medicare Parts A and B. Now, why take a Medicare Advantage plan or a prescription drug plan? Okay. Well, like I said, initially the emergency room. Okay, that's going to be a much easier to just file to get your $100 back than it is to get your 20% back. Having an Advantage plan is going to give you more choices, access to more providers, just those outside of the VA, second opinions, more specialists, better formulary options, right? Remember the restrictions that you had on certain drugs at the VA. Although, like I said, with the formulary, it's tough to beat that 700 max out of pocket, but it's still nice to have some other options in there. Savings opportunities. What that's really referring to is there's a lot of areas of the country that have Part B payback programs, because they can provide services at a low enough cost, and the plan extras. I mean, dental, vision, gym memberships, over the counter. I mean, those are all some really great benefits that none of which are available at the VA. So the combination of a VA healthcare and a Medicare Advantage plan really provides the most options for people that are using the VA. Now, we have to talk a minute here about some other programs, because I want you to be careful with these here. The first one is called CHAMPVA. CHAMPVA is for the spouse and children of the veteran who's been, permanently and totally disabled from that service-connected disability. Okay. So the surviving spouse and child, once that veteran was on the VA, with that service rated, we always going back, and I was pointing out that service-connected disability is really important, is going to let the child and surviving spouse use the VA also. Yeah. For those that is the spouse, they're going to have to get their Medicare Part A and B to use CHAMPVA. And that max out of pocket of $3,000. You're going to see it again in TriCare, but it really deals with services that are not covered by Medicare that you're trying to pick up, and that's going to be your out-of-pocket for a lot of that. I'm always asked, well, what kind of services are those? And I always point out things like, acupuncture is not covered under Medicare. Now, naturopathic doctors are not covered under Medicare. Some very limited chiropractic services. So, I mean, you can come up with stuff that's not covered under Medicare, and so that would be your max out of pocket. Now, CHAMPVA is going to include that prescription drug coverage. Now, CHAMPVA is not like regular VA for the member, right? This is, again, these were not the veterans, these are the spouse and children of veterans. So once you turn 65, Medicare becomes primary and CHAMPVA becomes secondary. Okay, so they're requiring the person to, that Medicare is going to pay first, and then CHAMPVA does. Now, they've got a lot of little rules in here. So, I mean, one could get a Medicare Advantage plan, but when it comes to the coordination of benefits in there, remember, because with the Medicare Advantage, now that's your Medicare provider. And so CHAMPVA does not play well with others. And you can easily wind up with your CHAMPVA denying payment in there, because they just don't coordinate well. I mean, all in theory, everything would be fine, but the experience has been not to, unless there's some real overriding reason, to avoid working with these folks. I'm going to tell you up front that in all the years that I dealt with Medicare, I had one CHAMPVA member, and I did not sell anything to them. The other big group is your retired military. Okay, now that's called the TriCare for Life. Now, TriCare is the health and drug coverage for both the active duty and retired military. And the old name was CHAMPVA. So if you get a hold of some old timer and they want to call it CHAMPVA, know that it's TriCare today, and they're just throwing, one of those cantankerous old folks is just messing with you and using the old name. Now, CHAMPVA and CHAMPVA are no relationship at all. It's just that was the name prior to TriCare. Now, once you have TriCare and you've turned 65, you have to again go on Medicare. Okay, so they require that you have A and B, and so that when you take Medicare and TriCare and bring them together, that's now known as TriCare for Life. Now, the way that TriCare works is that it's like having a supplement. I don't know any other way to cover it. It's like having a supplement that you don't pay for that includes drug coverage. Okay? Maybe like an old Plan J or something like that. So it's kind of the a wraparound. Now, again, there's not going to be a whole lot of these. You'll run into them, but there's not a whole lot. I think there's roughly about 2.25 million retired military out there. I mean, less than 20% of the people that join the military stay through retirement. So there's not a huge amount of retired military. Like I said, about 2.2 million out there. And the question is, best. So here's kind of the table. Okay, it acts like a med sup. Medicare pays first, and TriCare for life. We talked about the max out of pocket, but they pay no premiums, no copays, and that drug benefit is built in. It's not a big deal now that it's not subject to the gap, but it was going back a few years. Whereas if you do get an MAPD, you're now in a network, right? But you can pick up some exclusive providers. Maybe it's a doctor that you wanted to get, but you couldn't get with TriCare. It does make your TriCare secondary. You may have to pay premiums. That processing that went on in the back between medical and prescription claims, it's not seamless anymore. And depending on the plan, you may have referrals required. So just as long as they fully understand what they're getting, there is no problem in putting a TriCare for life person into an MA or MAPD plan. So let's look at some of the things. I was telling you that dental is not covered by either the TriCare or the VA. Well, if you're at the VA, the kind of things that where they will cover your dental, it goes back. It's going to be that priority group 1, 2, and 3. Okay, so that was some kind of disability, service connected, or Medal of Honor, Prisoner of War, Purple Heart. Okay, so that's who gets dental. So that applies for both over 65 and under 65. You can help anybody who's using just the VA with the dental plan. And I would also look at vision. Now in vision, And like I said, don't question over the rhyme or reason, but they threw in priority group 4. Okay, that was those other disabled people, but they were not service connected. So somehow they get vision. Okay. So that's what I was saying. Here's a group of holes here: dental, vision, and most VA recipients don't even understand how Medicare works, and nor have they taken any effort to find out. And they might even know that the VA may not cover a civilian doctor. And like I always really pushed was that emergency room kind of situation and all of the other things. Now, let me tell you what I found typically happens. There's some plans out there, and it's usually the easier sale at first, is that it's an MA only plan, right? You're going to get your ability to get all of these little extras. You're covered covered for the emergency room. The cost was usually $0. And if you needed to see a doctor that was in town rather than driving to the VA, you could do it, right? And but you were going to fill all your prescriptions at the VA because that's what they were already accustomed to, and they really liked that. Well, the first time that doctor in town wrote them a prescription, and they found all those hoops they had to jump through to, get it filled at the VA. And it came back time for renewal, and I was talking to them again. They typically wanted to switch over to an MAPD because they just wanted that ability to not have to have that hassle at the VA to fill the prescription. Okay, so while it was an easier sale up front to use just an MA, after they'd been in it for a while, since they didn't give up usually any of those additional benefits, the gym, the vision and dental and that sort of thing, that they really found that using the MAPD was a little more advantageous than they thought at first, even if it turned out that they had a premium to pay. Okay, some special enrollments. There is one here that kind of fits. You want to be careful with that. But what it says for this special enrollment is that somebody has come to you, they are a VA, a CHAMPVA, or TriCare for Life, and what they have already done is enrolled in like an MAPD or maybe just a Plan D. And they have a once a year, one-time special enrollment opportunity to go to a MA plan. So you can enroll them in an MA. So just something that's out there that might be useful to you, right? But it was a two-part, right? Not just VA, CHAMPVA, or TriCare for Life. You had to have that and already were enrolled in one of the other plans, and that gave you the ability to make a change for them. Any questions? You can always email me at training@ahpsales.com, and I'll be glad to get back to you on any of your questions concerning the VA and or Medicare. You have a great day and good selling.